Hello, everybody, and welcome to another episode of Beyond Talking Points with Matt and Matt. Um, Today, we are going to talk about a psychiatrist, Thomas Szasz. Is that his name?
I think it's the hardest name to pronounce. People who are in the know probably immediately know who we're talking about just because we have to have this discussion. But I think it's Szasz.
Thomas Szasz. Szas, is it?
Dude, I don't have it in front of me.
Alrighty. Well, anyway, he was, I think he's dead now, but he was a psychiatrist, pretty influential one. Well, I don't know how influential he was, but he was kind of an unorthodox psychiatrist because he was questioning a lot of assumptions within psychiatry and assumptions within the mental health field. So, for example, he was against coercion in the mental health field. So he thought, if you're gonna have a relationship with a psychotherapist, or if you're going to be on psychiatric medication, or if you're going to be hospitalized, it all has to be with your consent. Nobody should be able to involuntarily hospitalize you or involuntarily put you on medication or force you to take therapy because of Szasz thought that in normal medicine you don't force people to do something. So the example he gave, we watched a short 22-minute video where he was answering some questions from an audience, and the example he gave was a doctor doesn't force a diabetic to take his insulin. The doctor says you should take your insulin. If you don't, you could have serious health problems or you could die. But they just let the person make their own decision. But of course, in psychiatry and in the mental health field, we don't often do that. If someone says they're, going to say commit suicide, or should I rather say kill themselves, since there's a question of whether we should be using commit in that context. But if someone says they're going to kill themselves, of course, the response generally is, well, we're going to, lock you in a mental health facility without your consent and prevent you from killing, and probably put you on medication, get you seeing a therapist or a psychiatrist every day, until you feel better, until you feel equipped to kind of deal with life's ups and downs. And then, they release you. Of course, that's the best case scenario. There might be people who are just stuck in facilities for the rest of their life for various reasons. So it's hard to know, I guess, where to take this conversation. We're just kind of winging it. But I just think I think it's an important conversation to have because people, you hear a lot of talk nowadays about the rise in mental illness. I think there's also some evidence that certain mental illnesses might be overdiagnosed, or at least no, I think that statement stands for itself. But so it's like back when, say, my grandfather was my age, you didn't have much talk. There wasn't much talk about mental illness. But now there is a lot of talk about mental illness, excuse me. And, so many people seem to be suffering from certain symptoms, and so many people seem to be on medication. And so the question, of course, is what's going on? That would probably be a good place to start the conversation, but I'll let you give your opening thoughts.
Yeah, I thought this is a really interesting idea because a lot of times we'll talk about something that is bounded by policy or something like that. And I just think the work that and a lot of the issues he talks about just raise so many questions that are almost hard to understand, but they're also almost like brain teaser type questions, or it's just conceptualizing things in a slightly different way makes a lot of things much more complex or confusing or hard to balance, because he is reframing the field of psychiatry not as just talking about things like somebody might be in a depressed state, blah, blah, blah. He's more framing it as, if we are going to treat this as a serious medicine, then why don't certain rules apply? Or why can you do these things that certain medicines can't? And then he's kind of saying, like, in the end, a lot of these diagnoses have been used to push interests like in the government. So maybe we should be more skeptical of these types of diagnoses, or when they're useful, and what does it actually mean to diagnose something, right? So at one point, it might have been a different video, because I did browse a few other ones before I sent one over to you, but he kind of like is willing to see that there is a such thing maybe as a mental illness if you do a brain scan on somebody and there's something wrong with their brain. And then that kind of like addresses certain famous psychological examples of people who got in serious accidents and acted much different, and then like it was found that they were like a whole part of their brain was what was I think it was missing, because he had a traumatic head injury. And I learned about that one in like AP Psych years ago, but I know it's a very famous one. People might know what I'm talking about. And then there was another famous thinker, I believe, or no, it was not a famous thinker. There was somebody who went and did something horrific, like a shooting. He had said, like, I want you to look at my brain after I do this, because there's something wrong with me. And it's like, well, he had a tumor that was pushing on certain parts of the brain. So he's not really talking about that. He's more talking about, like, when do we decide, or when does the government decide, or when do bodies that, take people and commit them to institutions against people's will, what is the bound to say we can do that? When have we decided these people cannot vouch for themselves? Like this is a tough question, and it's interesting to think about in the context of like nowadays people throw out insults, especially because of Trump. Really, people are very quick to say somebody's mentally incompetent if they do certain things. And I don't think a lot of these things are legitimate under scrutiny, right? Like, I mean, I don't want to make this about Trump, but like, I don't think Trump was the smartest guy. I don't think he said things very clearly. I think he ranted and rambled about things he didn't know about. But if people were like, he should be committed to an institution, it's like, okay, well, you don't seriously mean that, because if you seriously mean that, the implication is like, you're bound to force somebody against their will into an institution is very low, because there are a lot of people that are that belligerent. So he's almost making like the most strong argument on the radical end of saying there's never a time to do that. And you have to reckon with that to some degree. Like, it's easy to sit here and think about somebody who says like, I think I'm going to kill myself. And then you should be like, yeah, that person should be in an institution. But then it's like, well, a lot of people will say a lot of things and then never do them. And then it's like, well, now it's much more nuanced, because these things don't always follow from each other. And what does it really mean? Are some of these people saying it because of other things going on in their life? Like I'm sure people being put in institutions against their will has benefited certain people in the long run in some situations. But what does it mean to be like competent and have that autonomy, especially in this kind of setting? It's almost like the toughest scenario imaginable. So yeah, I think that opens up a lot of stuff there.
I mean, to some degree, I think it begins with, or I think conversations like this begin with, and I know it can be too easy to kind of dance around questions by asking about the definition of words. So I don't want to get bogged down in that at all. But when we talk about mental illness, I mean, what does that mean? And how do you define a mental illness? What is your proof that someone does or does not have a mental illness? I mean, and unfortunately, it's not really, it's not as simple as, healthy or unhealthy. I mean, even that concept itself is kind of blurry, because, I mean, if a diabetic, I don't have diabetes, let's say, but if you compare me and then you compare someone who was, say, has type 1 diabetes, they were born with diabetes, is that person unhealthier than me? So that itself, even with physical health, you would think that would be clear. Even with physical health, though, the concept of health isn't terribly clear, So it's like, when is mental health clear or unclear?
I want to jump in real quick, just because I think the important thing and this totally fits in with what you're saying, is like, is mental illness about classification, or is it about is about diagnosing, right? And the one of the questions he was asked is pretty much a guy saying, I was classified, more or less. He uses the term diagnosed, but he means classified as having a certain set of behaviors, or seeing things that weren't there, so something of that sort. And because he was able to be classified, he was able to get treatment that other people that had his, like, I guess you can put in quotes, problem, but were in his situation had. And then he was able to improve his life by being classified in the same way they were. So it's like, okay, well, you can maybe say, you can identify all sorts of things, right? You can identify people as introverts or extroverts. And maybe things like what we call like ADHD should be seen as something like introvert, extrovert. It just means you have tendencies to maybe have a shorter attention span more often than most people. I mean, a lot of people are easily distracted, but let's say, okay, you're more likely to have this tendency. You're more likely to have a lot of energy at certain times. But once you use the label of like mental illness, and this isn't just to be like snooty about how we shouldn't use words that make people feel bad, but it doesn't necessarily follow that any of these things, just because they're abnormal, should be treated, right? And I think that that's why it's like putting it under this label and saying like, these are diagnoses, right? These are like problems. Like, I don't necessarily need to fix being an introvert. So it's okay to classify things. But once you kind of put that judgment on like, this is wrong, we need to fix it. And maybe if these people aren't willing to accept it's a problem, then we need to force them to fix it, right? We need to institutionalize them and then fix the problem for them. It's like, well, now you've done something like potentially very, very harmful or wrong. So I think that's like the first barrier, is like, what is the utility of classifying versus diagnosing, and when is diagnosing even something you want to do? Yeah, sorry to cut you off.
Well, I don't remember exactly what I was going to say after that, but I'll just go off of what you said. So, I mean, to reiterate what I said earlier, the difference between a mentally healthy person and a mentally unhealthy person is not very clear. And one reason for that is, so I think the predominant well, I think the predominant idea now in psychiatry and psychology is that mental health is in large part a genetic thing. I mean, obviously everyone says it's some of both, but I think most people nowadays, or the consensus nowadays among professionals, is, oh, it's a genetic, it's a biological problem. But then of course you think about the field of epigenetics, how learned behaviors or adopted behaviors can be passed down genetically. Of course, and I guess I bring that up because it's not just when we think about mental illness, I don't think we should just think of it as like, oh, this baby. If someone, say, has depression or is diagnosed with depression, well, they were born defectively. They're like a broken robot. If they weren't a broken robot, they wouldn't have depression, but they're a broken robot because they have depression. It's equally possible that their environment kind of was itself pathological, and that led them to either adopt pathology or respond to pathology with pathology, if you see what I'm saying. So I mean, it makes sense if your environment or if your family unit, if your society is incredibly unhealthy, you can adopt those unhealthy behaviors, unhealthy attitudes and beliefs, but of course, on top of that, you could also make the point that, or there's an argument to be made that certain mental symptoms of mental illness are actually healthy responses to unhealthy situations or unhealthy stimuli. So I'm not necessarily trying to classify it as pathology. I'm not necessarily trying to diagnose, I guess, if I'm using your classified / diagnose dichotomy here. I actually knew a psychotherapist once, and he told me something interesting. He said every mental illness is a normal response to certain situations. So if someone sees things that aren't there, that can be a normal response given that they experienced this traumatic event or this or that their family was incredibly abusive or something. So I do agree. We need to take the stigma out of mental illness. It's not, again, it's not normal versus abnormal. It's not healthy versus unhealthy. And it doesn't mean you're broken. I don't necessarily think, well, I don't mean to jump too far ahead in the conversation. I actually don't think we'll probably agree for this whole conversation, but I'm kind of getting out of the way a lot of the things that I agree with you on. So you can respond to some of what I said if you'd like.
I'm on board with that. Yeah, I agree with pretty much everything you laid out there. It's one of those things where it's like, well, I don't know if I should get more postmodern on it or not, and maybe that's why you suspect we'll disagree, because maybe that's the route I'll take. And a lot of the people who I hear bring up Szasz do it, and they're usually more postmodern in terms of how they view things. And there's a way of kind of agreeing with him by route of saying you don't really know other people's experiences. You're making normative judgments on what is normal, right? And this plays into what you're saying, right? So if somebody had a traumatic event happen and then they started, dealing with it via hallucinating, then like maybe it's wrong to say that them hallucinating is wrong. Maybe that's the only way that they can cope with the grief or the horrific nature of that event. So to say it's wrong just because they're experiencing things in a less common way, right, doesn't necessarily mean it's a problem, or it's even my right to really step in and say this is a problem. You need to take this, even though this will have this side effects and will force you to confront this. And it kind of flows into like, well, I think this conversation can be broadened out in a big picture way to a lot of things. I mean, like it kind of lines up with talking about psychedelics and what their true state of reality is. So, because it seems like Szasz isn't afraid to kind of admit that some people could actually believe some of like things, and then those things could be seen as ridiculous by everybody, and everybody could agree that with that. But he wouldn't say that means mental illness. He would pretty much just say like, well, I don't want to put words in his mouth, but he can reckon with that. He can take that into account. And you can say something similar about like psychedelic experiences where people perceive themselves in a reality in which that is different than a sober state, but it feels just as real. And it's not really wrong to say it is wrong to say it's not real. I mean, even to simplify it to like being drunk, right? If you think if everything's spinning and you perceive time differently because you're very drunk, you're not wrong in the sense that that is your experience of it. So it is real to you, which is real. So it's kind of weird to have a system and where people can step in and say, like, no, you're not allowed to feel that way or experience or interact with life in this way. And usually it isn't a good way. I'm not willing to say, and Szasz accepts this, that people are suffering a lot of the times, but it's not to say like that it is false and that it needs to unilaterally be dealt with. I think that's his primary contention. So yeah, feel free to steer it in a different way if you want to get in a spat about something. I'm more than game.
Before we get into any spats, I wanted to draw a parallel between Szasz's work and Szasz's views and the views of Michel Foucault. Now we've talked about Foucault and we've talked about him tangentially probably many times, but we did a particular episode a while back on Chomsky versus on a debate between Chomsky and Foucault. But Chomsky, or I think Foucault, his first major work was called Madness and Civilization. And of course, Foucault is, I think he was in like the post-structural, that's a hard word to say, post-structuralist tradition, but he was also like some people who are more postmodern kind of take on some of his ideas. So he's had an influence across many philosophical schools and many fields. but he kind of came to a similar position, I think, as Szasz. Because he saw things, and this is why someone like Jordan Peterson despises him. He saw human history and human relations in terms of power. So he saw psychiatry as just an extension of people's desire to dominate each other. So, I mean, Foucault was a homosexual, and so he would comment on the medicalization of homosexuality back when doctors and psychiatrists said that it was an illness, and they would say, well, this was the society's way of putting their foot down on homosexuality, saying this is wrong, this is bad, this is evil. You are ill. There is, you can't be homosexual and be healthy and normal. And of course, no everyone agrees that was completely wrong. So that's just one point to bring up if we want to say anything about that.
So I totally agree with that, and I think that's why, like, there's the power dynamic involved in any medical relationship that is kind of inevitable, right? Because they're supposed to be the medical expert that tells you what you need to do, and generally you aren't in a good position to question them unless you've done very specific research on something and feel like a qualified person to talk about a specific thing. So I guess one of the issues that can come up when you talk about psychiatry is you have a lot of people who study it for about 8 years, but then they're pretty comfortable saying things like ADHD is a problem. And then, like, it's pretty easy for a normal person to sit here and say something like ADHD doesn't really seem like a problem if you're talking about an 8-year-old, because 8-year-olds are supposed to be 8-year-olds. And there's nothing that wrong with a kid having a lot of energy if they're in 3rd grade. And if they're not able to pay attention because they want to run around, that shouldn't be that surprising because they're an 8-year-old. So it's one of those things where you have this imbalanced relationship. You have a person who is allegedly an expert who sees a ton of patients, and you're coming in here as a person and you're saying, if you even have a hunch, it doesn't matter what the issue is, that something feels wrong, you don't really have the credentialed support of it. And that's why I think Szasz is staking out this position and cares so much about this position, because it's not that you're at the mercy in the medical situation, because even if you can be intimidated by somebody's expertise, you still don't have to take the medication. Like, he's not at your house with the taser saying, like, take the medication. But if you have other symptoms that are allegedly medical symptoms that are related to things like schizophrenia, well, then even if you disagree on the diagnosis, and maybe you don't think you're schizophrenia, maybe you think you're not schizophrenic, and maybe you're actually right. Well, if the doctor says so, like, this is super imbalanced, because you can, in that setting, you can have it forced on you, and that's scary. So then when you talk about things like homosexuality being considered a mental illness at one point, it's like, well, like, it can seem absurd to us in 2021 that these things will be abused, but it's very clear that there are times in the past where it's been abused in ways that we find, intolerable. And I mean, I don't want to sound too PC, so I gotta sandwich my statements with something somewhat offensive in the middle. But everything in, like, the neurodiversity movement is all about trying to destigmatize things like people having ADHD. And because they're kind of setting us up to look back at the 2000s and be like, why were they medicating all these kids? All these kids didn't need this type of medication. They could have been just dealt with differently, and maybe they would have all ended up happier or something like that. I will say, well, one of my issues with the neurodiversity movement is the same with a lot of acceptance movements, where a lot of them don't really just want acceptance. They really want you to like them. And I would say, like, you should just treat it like a personality trait, in the sense that if you don't like somebody for a reason, and it's a good reason, like they annoy you, it's okay to be annoyed by somebody if they have ADHD. You shouldn't have to like everybody. But the thing is, like, if we're being serious about it, you shouldn't institutionalize people for having different, like, for having ADHD. And that's when it becomes an issue. So yeah, I know I repeated myself a little bit, but I think that plays into with what Foucault was saying. And a lot of these standards change over time, right? So what we see as a concerning social ailment 15 years ago is different than now. And what we'll see as a concerning ailment now might be different in 15 years. We don't really know, and that's not a good thing. It also could be generational too, and not just in a literal time way, but in a way that it shifts, and there are people in a different generation that will not appreciate something, be the enforcers, and then people who are coming up are okay with it. And then there are the people in power do not agree with the people who aren't in power. If there's a clear generational divide, and it's like, well, it's based on psychiatry, which has mechanisms to have it, forced down, which is concerning. Yeah.
So this is where I think the spat shall begin. Get ready to rumble, as they say in wrestling, I believe. But so to draw a slight parallel, like I think people who are quick to, like, if you want to attack, say, the scientific establishment, what's the most obvious argument people make? They say, oh, well, people thought Newton was right, and then Einstein proved Newton wrong. Boom, scientists think they're just discovering truth, and really they're not. And it's a simplistic argument that people use to undermine the credibility, let's say, of science. But I think, again, as I said that, I think that's a simplistic argument. So I am, as is my habit, I'm sorry, Matt, I am going to take a much less one-sided position on this, or I'm going to couch what I'm saying in slightly more middle of the road language, because I don't think we can. I guess I'm not quite as comfortable at putting my issues with, say, the mental health field and with psychiatry in the way that you are, or in the way that Zaz is. I mean, for one thing, psychiatry and psychotherapists and clinical psychologists, I mean, they are, and to a lesser degree, social workers. Their job is to see people who, whose symptomatology is kind of disrupting their lives somehow, generally speaking. Again, it's not to say there aren't examples of people being, if you commit a crime, let's say you're violent to somebody, you might get off, you might not go to jail, but it's like, okay, well, on top of your community service, you got to go see an anger management counselor. The government might force you to do that, or, off to the jail cell, off to jail with you. But I think a lot of the time, it is people who say, like, oh, I'm lacking meaning in my life. I just feel like, I can't be happy. I don't know what's wrong with me, doc. Or it's, a child is acting out. A child is being extremely antisocial, being, very aggressive, or being, very withdrawn and not playing maybe in the way that most kids generally do. And I am distinguishing between, like, personality traits, just variation in personality among a population, and behaviors which can be detrimental to yourself and other people. Now, you can only go so far with kind of preventing that, but I think there are times when, it makes sense to go see a therapist. It makes sense to go see a psychiatrist. So that would be kind of my starting point for it. It's not a either or scenario, and Zaz himself was a psychiatrist, so I don't think would say it was an either or scenario. Although I don't know, with him it's kind of hard to say, because he says things that can kind of seem contradictory, but you have to parse out what he actually means. Go ahead.
I mean, I agree with everything you just said. So if somebody has depression and then they think their depression is a problem and that they want to resolve, then they should go see somebody. A lot of the time when Szasz is on is in a YouTube video, it's because he's staking out the position other people don't want to stake out, and that's about the edge case, more or less. And then that ends up boiling down to things that are relevant to psychiatry, but a lot of things beyond psychiatry, which is about like how he said that the medical institution or the medical establishments, are always end up being political. So I don't think he is really making contentions on that, and I'm not really either. Like if somebody is willing to accept like the prototypical view of say ADHD, and then they're like, yeah, I think this is a thing that's impacting me in a negative way, and they want to go seek out somebody who they think can help them resolve what they already personally identify as a problem, then that's like great. I mean, it's the same reason why I would go to the gym if I personally identify the problem is my cardio is not too good, right? So yeah, I mean, I'm fine with that. I'm not dismissing all of them. I'm really dismissing the idea that the expert evaluates you and then tells you what's wrong with you, whether you agree or not. That's when it's like the profession totally breaks down.
So this goes back to the conversation we had. I guess it was the second Michael Malice episode we did. On how much do you trust the experts? And I remember you did make a distinction between, say, trusting a doctor who says trusting an oncologist who says you have cancer versus trusting Hillary Clinton's foreign policy advice, let's say. And again, I think it really depends. I think it's a case by case basis. I mean, so earlier I said, certain mental illnesses probably are overdiagnosed. And I think two of them, from what I've read, are ADHD and autism. And for one thing, I mean, it's not as if patients don't have power. Now I know you're kind of talking about it from a broad political standpoint, and I'm starting with a kind of patient to doctor, then we can broaden that out if you want. But I mean, the patient does have certain power. Like if you don't like, if a patient doesn't like something the psychiatrist said or didn't like the diagnosis, you can get a second opinion. I think a lot of this, I guess, as you say, is the edge cases. I mean, I don't think there's a. I mean, I think the element of coercion perhaps is just similar to coercion or the power dynamic, say, is just similar to the power dynamic that my primary care doctor has over me. But I think of course, the difference is kind of in the sense that the doctor is focused generally primarily on my physical health. And the psychiatrist or a psychiatrist is kind of like a doctor of the soul, let's say. They're kind of trying to manage your your subjective experience. I had a point, and I'm afraid I lost it. So you can respond to that while I try to figure out what I was about to say.
Well, one thing that concerns me, and I think this is more of a question, if anything, it might be a good opportunity to clear something up for me. So like, if a doctor's giving me advice, usually there's like clearly something that's physically wrong, like my foot is swollen or something, or they take my blood and my blood is showing something very abnormal, and I was complaining about symptoms that manifest in that way. So usually it's less, there is less reason for a patient to doubt the doctor. Because usually there's a very clear reason that is kind of unavoidable to have to come to the doctor. And it's like very in your face and you can see with your eyes. Obviously, though, I mean, this seems obvious to me, but anything when we're talking about the mind is far like exponentially fuzzier in terms of what is normal, what is abnormal, what is dangerous, what is not dangerous, what could potentially be dangerous. Like an element of these decisions that psychiatrists have to make is actually like forecasting. Like it's like he may be sad, but is he potentially a risk? And then it's like, what is the likelihood that I am wrong? Like, so it's not as clear and cut as a lot of medical advice. Like I know a lot of medical complications happen, but usually the elements of it are not as abstract, right? So there's multiple levels of abstractions, and I think that's what opens up more room to these edge cases where somebody's like, well, I don't really agree with what my doctor's saying. And that's what gives me pause to like this being a kind of a bigger, like a kind of big picture concern. So I guess, do you think that distinction between mental and physical health is a crucial element? And do you think it's as fuzzy as maybe I'm saying it is?
Well, I mean, so this is partly anecdotal and partly just kind of, I guess, a kind of a view I've come to from, I guess, studying. Well, I haven't studied medicine formally, but I've like kind of read a little bit about it here and there over the years, as one often does. I'm actually not sure. See, I think medicine itself is kind of a weird. I mean, actually, go back to Foucault. Another one of his books is The Birth of the Clinic, and so he basically extrapolates what he said from the mental health field and says it's the same for the medical field. He says the medical field is, again, or at least the way we understand it in the modern world, the way it was understood when Foucault was around, is a way of controlling people, is a way of exerting power over people. So actually, I see what you're saying. Like, yeah, of course. Like, if my foot is if my foot is swollen, then that is different from me saying I'm depressed. However, I actually think the diagnosing, even in when it comes to your physical health, is very fuzzy. At some level, medicine is a bit more of an art than a science. It's definitely not a very precise practice, which is one of the issues. But well, you respond to that. Then I have a couple things to say.
I'm not really trying to make the argument that I'm not trying to make the argument that physical medicine doesn't have these similar problems. It just seems to me that they're significantly worse when it comes to the mental health one, because you're dealing with abstractions and you're dealing with normative opinions on how people should act. So it's like I think I'd agree with Foucault about physical health in a lot of ways, but I wouldn't if he was trying to tell me that a broken leg meant more than something else. I mean, he could tell me that the amount of pain meds you prescribe for a broken leg has to do with certain things that are cultural and social, and it is an art. But a broken leg is a broken leg to some degree. Now, a person being like less happy than normal isn't as in your face and as a broken leg. That's why I'm less saying that there's no art elements to the physical and more saying on a relative basis, it's more so in the mental. That's how it appears to me.
So I think, I mean, again, this is kind of a very, there's so many things like floating around in my head right now. It's hard to grasp one. But I almost think that this conversation goes back to, I feel like I'm in these episodes now, I'm like reminiscing every time about a previous episode, which maybe I should do that less. But one of the many longstanding disagreements we have, I guess, is kind of our conceptualizations of human nature. And I guess I worry when I hear you, I guess, giving the arguments you're giving. It kind of portrays humans as freer than they really are. I mean, freer in the sense that more detached from kind of say the biological or material world. More and which kind of goes with what you're saying about just what you say when you question like kind of group identity, when you question a broad like all-encompassing human nature due to the variations among individuals. I mean, I think so. Earlier, I said that mental illness can come from the environment or can be a response to the environment. But ultimately, we are biological organisms. Ultimately, we are animals, and so mental illness should be able to be explained on that basis. I mean, as I've said before, psychology is just, I mean, at some level, it's still like a very young science, because the human mind is the most complex thing in the universe. And so, I mean, the reason it's easy to make fun of psychology, and the reason it's and psychiatry is because we don't know that much more than, say, you know, Freud and Jung and the early psychoanalysts did. We know some more. We know a little bit more, but we don't know that much more, and the field hasn't progressed that much. But I want to give another example before we broaden out again. Like when I think about children, and when I think about that's kind of, I guess, where this I think I could see a greater need, or when it comes to children, I see less of a conversation about like, oh, it's just kind of about freedom, and it's about like the individual gets to choose this or that or the other thing because they're an adult and they can decide whether this is a problem that needs medication or not. With children, it's trickier, I think. Now, of course, you brought up ADHD. I think a lot of children. I think ADHD is overdiagnosed, and it is important to not. It is important to not look at kind of the natural way children play, and children, and the natural way children can be very energetic and rambunctious, and say that's a disorder. Here's some Ritalin. On the other hand, a child, by virtue of being a child, if they are having behaviors which again are they're causing them to struggle in some way, I think it's very important for the parents or the teachers or the guardians to take them to a mental health professional and try to help them work through whatever it is they're working through. Because the child doesn't really, because the child is young and their brain isn't fully developed and they're not experienced and whatnot, they can't really say with a great amount of certainty, this issue, this thing you're labeling an issue isn't actually an issue, and here's the reasons why. They're just kind of, you know, living their lives almost solipsistically in a sense, you know, very self-focused. And I don't mean that I'm not giving that a negative connotation. So yeah.
A thought I have running through my head is about, and I think that this might be one of the flaws of what makes mental illness is if it's about what is normal in like a normative way, or is it about what the ideal is? Because in a way, like, I mean, this is very obvious to say, but if you drop somebody from the 1930s, you know, in Manhattan tomorrow, they would, you know, not recognize anything going on around them and would probably think our society is like incomprehensible. Something like that is kind of like believable. So is the issue that mental illness is about correcting things that are not normal, or is it about correcting things that are bad? And what does that mean? And the thing that makes me drop this distinction, I guess I'll give you this to work with too, is well, for some reason, of course, the you know, the book Brave New World had to come to mind. And in Brave New World, how they, you know, desensitized their population was essentially being like, hey guys, you know what's cool about this sweet drug? You don't get sad anymore. You don't get sad anymore, and you just kind of feel good most of the time if you just take this drug. It might dull some of your senses, but you don't get sad. And then you take Soma, right? So it's like, well, if there was something that like made it so nobody got depression ever again, so you like got rid of a ton of deaths, you got rid of a bunch of stuff, but then it like dulled some things that we would currently consider natural, then is it good? But then it's like, well, we've already diluted plenty of things that we would see as natural if we were 200 years ago. So it's like, what do these things mean? And I guess that is a postmodernist thing to say, but I'm almost not trying to put it in philosophical terms. I'm more of just thinking like, is this about the normative or about like the goal? I don't know if that dichotomy makes sense, or thinking about that way makes sense, but I just want to throw it out there.
Well, I was hoping I made this clear earlier, but I specifically said, take the stigma out of mental illness, take this idea of normalcy and throw it out the window. I mean, to some degree. That might sound like I'm going to rephrase that statement, but I mean, normal versus abnormal is not healthy. I don't think it's helpful phrasing. Neither is bad or good. Um, but so I actually like going back to your example earlier about like hallucinations or if someone had a really traumatic childhood and then their brain or their mind to kind of like either shield them or to like compartmentalize or to do something to was doing the brain was acting in such a way as to produce hallucinations due to their traumatic childhood. And earlier I said, well, that's normal in the sense that that was their environment and that's how the brain responded. But then I don't think I can say, I can say that that is real to them. I can say, but I don't think I can say, therefore nothing should be done about it. I think because hallucinations can and almost always do lead to significant behavioral disruption and interpersonal difficulties. And I don't have to say that I don't have to get into a conversation about like, well, is the way our brain is programmed, does it actually give us reality, or when you're taking shrooms, is that actually the ultimate reality, and this is like our brains protecting us from the scary reality. It's a purely kind of practical point that it can be very difficult to go about life if you are plagued by hallucinations. And quite often those hallucinations are very scary to the individual having those hallucinations. There could be a voice telling them, terrible things, or telling them to do terrible things, or just constantly berating them. And I don't mean like the intrusive thoughts. I mean, you literally hear a voice saying like, you're a monster, you're garbage, you're terrible, you need to die. So that's really, I guess, my response to that. I do have something to say though, or I want to talk a little bit about kind of how psychiatry or the mental health field can be politicized. Did you want to say anything about what I just said before I go on to that topic? Or
I think in general that the stuff you said is fine, and this is something that I guess I would just, the person in the room we're talking about, which is Zaz, he does reckon with those types of questions, right? It's not something he shies away from. That's the thing he's confronted with a lot. And I was just going to keep dragging us down the hill of normative and but I don't think that's the hill we want to drag down, because I think we just kind of like are accepting that we 70% agree. So I'm okay with you taking it to the political direction, because that's always fun.
Yeah, so I mean, I think something else Oz talks about, and this is not original to Zaz, but I mean, if someone wants to be critical, an easy way to like criticize or poke psychiatry with a stick is to go look at the Soviet Union, the history of the Soviet Union, and say, look, the Soviet Union used psychiatry for political purposes. If there was a political subversive that they didn't want, they could easily find a way to diagnose the person with something and lock them up for the rest of their life, and they didn't have to worry about the person being subversive, because they were locked away in a mental institution with this incurable diagnosis, which the doctors said needed to be treated in such a way as to keep them hospitalized. But I think we can we can find a way to take or we can find a way to accept that there's a role for the mental health field, and we can say that yes, people have abused it, and we need to try to make sure that as best as the individual can, and as best as profession can, as the, if you'll forgive the phrase, society can, to try to make sure that the abuse of psychiatry, or the abuse of psychology, or the abuse of medicine, for that matter. So that, I mean, that's I see why people. I mean, I understand perfectly well why someone would bring that up, but I don't think that means therefore we can abandon psychiatry because it's all about individual. It's just all about the variation in a population. I think it's just it's bad psychiatry is what it is. And you can fight bad psychiatry or bad psychology with good psychiatry and good psychology. I'm sure that's not a satisfying answer to you, but that would be my answer.
So one thing that happens when we talk about things is and I guess I'm not even sure if what you just said is even a critique of what I'm arguing for. And I don't know if Szasz is arguing for that either. Like, at no point have I come out against psychiatry as existing. I just don't think they should have certain powers. So if somebody like agrees with the definitions that psychiatry puts forward, and then sees those as problems in their own lives and then wants them resolved, then like I'm more than okay with those people doing that. I get more concerned because of the power that psychiatry is given in society. And these are things that are, and this is why he always brings up, he's like, this is a political question to say, like, when is it okay to institutionalize people? When is it okay to force people into this against their will? And I'm not okay with these bodies having that power because I think it's ripe for corruption or for certain things being pushed in a way that is not good. Now, I don't think that means the field should disband. I just think they shouldn't have that power. And there would be some negatives to that. Like, I'm sure that power has helped people, but I'm also, there are horror stories of people being institutionalized when they shouldn't have been. So it's kind of like I would err on the side of freedom, and I would be happier if that field didn't have that lever of power. But I mean, just because I don't like in the general, like in a philosophical way, I push back on the idea of mental illness existing. And it's because I see these normative values getting pushed onto people who have predispositions that are like out of the norm. And I don't think those things are necessarily bad. And psychiatry's goal is to cure these things. Well, I'm okay with them curing those things if people want to have that cured in them. If somebody sees that as a personality trait, or that's a way that they interact with the world and they want to be that way they interact with the world, I don't see why psychiatry needs to be an element of their life. But if those people see that as a problem and a barrier and they need to move forward, then there can be people there to help them and meet them on that level. It's just really an issue when the people disagree. And when the people disagree, the person should be allowed to walk away. And if they're not allowed to walk away, then you have a big problem. So I don't push back on the institution existing. I push back on one of their powers.
All right. Well, all right. Then I guess I need to put my argument I need to rephrase it. So I'm going to use one particular example, then I'm going to broaden out. So imagine there's like, a 14-year-old girl, and she like breaks up with her boyfriend, right? And for whatever reason, this causes her, this triggers intense depression in her, and then she, is fully intent on killing herself. That would be an example of and so again the current system says, okay, we're going to take that 14-year-old girl and put her in a mental hospital for say 5 days and see what we can do. That would be, and I don't know what Szasz would say about that particular example, but someone could say, well, Matthew, that is coercion. And I guess I would say, well, yes, it is, but I'm okay with coercion in that context. I'm not sure you can fully get away with coercion, if we're going to use that phrase, even in the psychiatric context or the medical context. I don't think we can leave it totally up to freedom. Another example, of course, would be, again, if certain mental illnesses or certain symptoms are causing issues to other people, that I don't think we necessarily should leave that up to freedom either. I think you can.
Okay, wait. No, we have to take it one at a time. We have to take it one at a time because I think I don't want to have to rebut like two things though. I have to take them one at a time. We're not going to be able to do it if you lay out like multiple hypotheticals because you're ready to. And I'm okay with talking about them. We just need to take them one at a time. Okay, so the first one, so since she's 14, it raises the parental rights issue. And that's like a contention that I just don't even have a lot of thoughts on. But I would say, given that she's 14, if the government wants to put her in the hospital ward, if the parents are okay with it, I think I'm generally okay with it. But that's because I don't have a lot of strong thoughts on when teenagers and their parents dispute and what the recourse is for that, just because that's such a niche thing. I haven't thought about it a lot, and that's very complex. Now, if we take your hypothetical, though, and you make her 18, I'll tell you why I'm not in favor of the state having that power. And if you make her 18, it comes down to the psychiatrist word versus her word. So the same hypothetical you're laying out of, well, she'll certainly kill herself. Well, the psychiatrist thinks she'll certainly kill herself. But one, it's like the psychiatrist can't know that for certain. Like I don't know how you could know that for certain. Well, one of the things Szasz says is like, even if a person who seems not in their wits is telling you they're going to kill themselves, like that doesn't really count for certain because so many people say that and don't kill themselves. So it's like, okay, well, you're going to have so many false negatives in that type of situation that you're going to be taking people who wouldn't end up doing it. You would never know if they weren't, so you won't have data for it. And you'll be, forcing them into one option. And you won't ever know if you're right or wrong. And it will err on the sides of being conservative in the anti-liberty direction. And that's just not something I'm okay with because you can't know that in real life. So even if the hypothetical is true, it's like, well, if you did know it for sure, you should institutionalize her. It's like, yeah, unfortunately, that's impossible to know. So if she's 18, I would say no. And if she does, it's like, well, that's terrible and it's a tragedy. I would agree with that. And like some people do have like are in these very terrible situations. It just doesn't mean you should always err on that side of, I'm going to take you and I'm going to force you to sit in this room because I don't trust you. Even if like you have to recognize that to some degree, the doctors or the psychiatrists will be wrong. And those people will not be planning on harming themselves, and they won't be harming themselves plenty of the time when they are institutionalized instead. And I just don't see recourse for that in practice. That's how I feel about that example.
All right, I'll give you one more example, and then I'll respond to what you just said. And let's say I'm trying to think of this. I need to phrase this in a very particular way so we don't get into a rabbit hole. But imagine so somebody has some mental illness, if we assume that mental illnesses exist, say they have a mental illness, or say they at least have symptoms. They have symptoms that cause them to behave in extremely aggressive and extremely violent ways. And so, somebody, does somebody. So this particular person, they're out at a bar or something, and then, they get extremely aggressive. Let's say, they attack someone. Now, in this system, of course, you can have the law. You have the law enforcement or the government. They might say to the person, well, okay, we're not going to send you to jail. I think I brought this example up earlier, but you can go to jail, or you can go to anger management therapy, and we're not going to send you to jail if you agree to go to anger management therapy and work through this with a trained counselor. Or we will send you off to jail. Because of course the idea is, if you do nothing, the person could continue to get violent and continue to just disrupt other people's lives. So that's another example, I think, where coercion might be necessary if you're disrupting other people's lives through your the certain symptoms that you're experiencing. Now, I know since you're an ANCAP, the government the authority of the government isn't legitimate. But if we can not go down that rabbit hole as well, where's the enforcement mechanism for keeping other people safe if someone has symptoms that could lead them to potentially be dangerous?
Yeah, I think that example is very poor. And I say that as your friend. And I kind of saw that's where you're going with it. And that's why I made you separate the two. This is how I feel right now is how I feel when I talk to my dad, who worked in law enforcement, about any hard drugs being legal. And he says, well, if meth was legal and somebody did meth, a lot of people, if they're, on meth, hurt other people. And it's like, well, yeah, but the recourse against them, same with a mentally ill person, is the same recourse as if me, a not mentally ill person, goes and pummels your face in, right? It's like there is always a recourse. There are recourses for people being violent. It doesn't really matter as much why they're being violent. We have protocols in place for when somebody does do that. So I don't see why it should necessarily be any different. It's just somebody manifesting violent antisocial behavior. It's like, well, we already deal with that without even acknowledging their mental health status. Like, I don't even think that's relevant. I think this is already resolved. I don't think there's anything deeper there. Like, I've name dropped restorative justice a few times, and if you had a restorative justice system and you realize that dude was just a person who was clearly mentally disturbed, then maybe the right thing would be to say, well, instead of locking him in a cage, because in this hypothetical, you already have the government and the two options are anger management and a cage. It's like, well, maybe the victims would be happier knowing that person tried to get some sort of normative treatment that would be hopefully somewhat effective in helping their mental health status. And it's like, yeah, if you're already, it's better than putting them in a cage where nobody tries to resolve it. But I think anytime anybody does something violent, even if they're not mentally disturbed, somebody probably suggests at some point along the road anger management. So I don't really know if there was a specific angle of that you're trying to bring out, but it's like when it affects other people, we already have rules for when we affect other people.
So what I'm trying to say is, and then I do need to say something else about the earlier point you made, but I think there are. So this is another example where maybe we would disagree, but I think an issue with the way that our system currently deals with crime actually is they don't take mental health into account as much. It becomes a matter of, oh, you beat up that person, you're evil, you're a bad person, we're gonna lock you up, you're gonna lose certain almost basically aspects of your humanity because we've deemed you just utterly broken, to use a phrase I've been using multiple times in this conversation. But there needs to be a corrective for that, because I bet a lot of the people that commit crimes, a lot of people sitting in prison right now, they probably had untreated mental illness. Now, of course, again, I'm assuming mental illness exists in this argument, and I'm perfectly happy with saying it does, even if it's not as simple or as obvious as a swollen foot. But so I'm not. So that would be what I'm really trying to say. It's not necessarily just a criminal matter, but I do want to comment on suicide, if I may.
Yeah. I feel like I agreed with everything you just said in the sense, like to some degree, I don't know where we're disagreeing on that point, because I'm like, I think our criminal justice system doesn't make anything better, so I'm not going to defend it. But yeah, I think we just disagree on the presupposition of what mental illness means. So I think I agree if I just grant that.
So going back to your example about like the 18-year-old girl or 18-year-old woman whose boyfriend broke up with her and she goes to intense depression and wants to kill herself. I do think, so going back to what we said earlier, about like, you know, getting out of this idea of good and bad, normal and abnormal. The and this goes back, of course, to just the influence of Christianity on the minds of people in the West, because Christianity thought suicide was immoral because you know, God had a plan, basically. Unless you were basically a strict like Calvinist who thought, you know, everything happened, like everything was God's plan. If you're the kind of Christian that believes you have free will and you kill yourself, well, you're kind of going against God's plan, so you're going to go to hell. And it's because it's immoral, because you're not your own. You don't own yourself. God basically owns you. You are accountable to God. You're not really accountable to yourself, except insofar as your actions relate to your relationship with God. So people have the same attitude, and they're like, well, it is immoral to kill yourself. It's selfish. It is bad. It is wrong. And if you do it, you know, you should feel ashamed. And it should go without saying, although I'm going to say it anyway, that is not an endorsement of suicide. I don't think I don't think in the majority of cases of suicide is the answer. But I do actually agree with you. I don't think we can criminalize suicide, and I don't think we can call suicide immoral. I think you have to. I think ultimately it is. If one owns anything, or if one is in charge of anything, it is one's own life. And I don't think we can make an argument that other people kind of own your life, or God owns your life. Therefore, you know, it is never an option to end your own life. But again, it's kind of a case by case basis. I'm not in support. I would not allow that 14-year-old. If I had anything to do in that hypothetical scenario, I would prevent the 14-year-old from killing herself. And I would, if I were talking to the 18-year-old, I would try probably to dissuade her. I would probably say like, no, I don't think you should do this for X, Y, or Z, because you're 18, you're young, you have a whole life ahead of you. I don't think your boyfriend breaking up with you should be the end of the world. But of course, you know, euthanasia is a problem in the United States because the United States is just a backwards country. But you know, this idea that like if you're 80 years old, well, you don't even have to be 80. Let's say you're 32 years old and you're diagnosed with terminal brain cancer. You know, in some states, it's illegal for you to physician-assisted suicide is illegal. I don't think it should be. If you have terminal cancer, doesn't like you should be able to end your own life. Whether it's, I mean, it doesn't even have to be with a physician though. Actually, you should just be able to end your own life. Doesn't mean you're bad. Doesn't mean you're wrong. Doesn't mean you did anything wrong. So yeah, I think suicide is a very difficult issue. At some level, I'm almost uncomfortable talking about it online, but I decided I would go ahead and do so. That is one issue at least where we would mostly agree.
Yeah, I think we could have had a really fun, and I'm saying this because we're wrapping up the conversation, but I think we could have covered all the same points if we started from the idea of physician-assisted suicide is something that a lot of people can get behind because we're all willing to recognize the type of pain the person's in and that they're imminently going to die. And then you could have like a really bad conversation about, so when is it okay for people to get to kill themselves, given that a lot of people accept physician-assisted suicide is fine. Let's work backwards from there to the minimum level in which it will be endorsed. And I think this kind of is what gets at it, is like, what does pain mean to some people? What does pain mean to other people? What does a traumatic experience mean to one person? What does it mean to another person? And a lot, I'm just using this to shoehorn in my general postmodernist kind of, and not in the literal way, but in like, I guess the it's like a vibe, right? if you wanted to apply a broad lens to what I'm saying, it's all like vaguely of the postmodern variety. And I think that's the way of like, some people have the intuition that it's like, no, but you have to keep living no matter what. And then I'm like, well, a lot of people will accede that certain people can kill themselves. So then it comes down to, where do other people draw the line and when is it valid? And you and I would both be on the team of, well, let's try to get the 18-year-old girl not to kill herself. So there's that much. But in the end, I think all this stuff is so murky, which is why I bring the libertarian, the word I hate, but the libertarian ethos of being very skeptical to do any coercion because it's murky. And I think a lot of people who are like even blue-pilled libertarians identify with that. That's like the basic definition of libertarian. It's like very, very skeptical of any force and anything that's kind of murky. But I'm okay where we got with this one and how we talked it through, and we can agree to disagree on some parts, and we did agree on a lot, because I think both of us in general are more skeptical to some degree. So you can add anything, I'll sign us off.
I mean, I guess what I would add is I think it's important to study kind of the history. That's why I'm big a history buff. It's important. I think it's important to study the history of these things and the history of psychology, the history of psychiatry. I think it can help you understand why we've gotten where we are. It can help you to understand why mental health is the way it is nowadays. I mean, even if you just study not even necessarily a history of psychology, but just the modern history in general, you can kind of trace. You can find the thread of the environmental causes that might be causing the environmental causes that might be leading people to experience these symptoms. And again, it's not because they're broken, isn't because they're weak. It's because we live in a time which is, or the world has kind of, human history is kind of unraveled in such a way as to lead us to a time and place where, I mean, people are questioning, questioning received wisdom, questioning institutions, questioning the meaning of their own lives, and then questioning, the dichotomies of, if there is a dichotomy of between the individual and the community. I mean, people are really trying to reevaluate kind of the world we want to live in, and that itself can cause a lot of distress. So, you don't want to over medicalize the human condition. But I still would reiterate, I think psychiatry and the mental health field is important and necessary, and I don't see a way to get coercion completely out of it without just kind of without just a view of human nature, which I don't subscribe to.
Okay, well, I'm content enough with that being the last word on it. I'd push you more back on that if we hadn't already talked for like an hour. But I think we covered a lot, and I don't think we need to get in the bogged down in what is likely a not very what's the word for it? Interesting disagreement, where we squabble over like 2 words for like 20 minutes. So we're gonna not do that, or we're gonna call it good. I'm glad we ended up talking about Szasz's work because it is interesting. I've wanted to listen to one of his books for the longest time, so hopefully I'll get around to doing that. And then it's something that if we find out another interesting related thing, we might always, this might be the kind of conversation that I could see being in the framework. That's something we reference a lot in the future, just because there are a lot of examples that kind of tie into what he's arguing. So I'm definitely glad we ended up getting around to him. On that note, you can find all the episodes Beyond Talking Points on YouTube by searching Beyond Talking Points, and on all your podcatchers. You can find more of my stuff. I do a solo show called the Obey Podcast. I just rant about stuff. Matt has a YouTube channel called The Anti-Philosopher. He does other sorts of videos about things that are in the in the realm of the kind of things we talk about on this show. I think might be a good way of putting it, because in some ways it's broad, in some ways it's narrow. But he'll review books. He'll talk about other things that come up in day-to-day life. He'll share interesting thoughts on things that are going on. So you can find that at The Anti-Philosopher on YouTube. Until next week, when we argue about something else that we have not decided on yet. Signing off for now is Matt. Thank you.